Hello, everyone. My name is Joshua Mann, and welcome to another episode of our CCC Spotlight Series. Today, I'm excited to welcome Gina Nuccio. Gina is a pediatric oncology genetic counselor at St Jude Children's Research Hospital in Memphis, Tennessee. She received her Bachelor's of Science degree in psychology from Clemson University and her Master's of Science degree in genetic counseling from the University of Texas at Houston. She previously worked as a prenatal and adult cancer genetic counselor for several years before joining the team at St. Jude in 2015. Gina serves as the point of contact for the VHL Clinical Care Center at St. Jude. Gina, thank you for joining us today.
Thank you for having me.
So let's jump into it. When and why did you first decide to become a genetic counselor?
So I first heard about the career field in my freshman biology class. So I was about 14. We were learning about genetics and I was completely fascinated. I could not learn enough about genetics. And then I learned there were actually careers tied to the field of genetics. I started doing some more research on my own and stumbled on genetic counseling. So I talked to a few genetic counselors in my area. I shadowed several genetic counselors and fell in love with the career even more. So I went into college knowing that's what I wanted to do and tailored my education towards genetic counseling.
What got you interested in specializing specifically in pediatrics and inherited diseases like VHL?
Yeah, that's a good question. So I have had, as you mentioned in my bio, I did adult cancer counseling for several years. And then I still am living in Memphis, but I moved back to Memphis and was here for several years and then heard about this opening at St. Jude. And back in 2014, 2015, when this was, the Division of Cancer Predisposition at St. Jude was being formed. It's a pretty new division, and they were recruiting genetic counselors. And growing up in Memphis, I'm a native Memphian, I had heard about St. Jude, I knew what they did, but when I came to interview for the position, I quickly learned all of the complex and the robust things that St. Jude does for their families, and that made me fall in love with the position even more. And so I've been here for about 5 years doing pediatric oncology, and it's just amazing. I know we'll get into a little bit later, but these patients and families are very, very special. And we have several families of VHL that we follow at our hospital and help coordinate their care, do education, things like that. So it's an incredible place.
That sort of leads nicely into my next question, is that what makes St. Jude such a special place?
Yeah, that's another good question. And I could be here the whole time just talking about that, answering that question. Many people have heard of St. Jude and know a little bit about what we do, but just to give a brief history, brief background. So the hospital was founded in 1962, and it was founded by Danny Thomas, who's a famous entertainer. And really he was opening it in honor of St. Jude Thaddeus, who's the patron saint of hopeless causes. And the reason for that is because at the time when the hospital opened, pediatric cancer was essentially a death sentence. Almost every child who got cancer died ultimately. And he felt that this was a cause that he could get behind and use his connections and his financial connections to help finance a center that was going to help find cures. But the big thing was that and the hospital still does this, is that families do not receive any type of bill for anything related to payment, or to treatment rather. So that includes things like obviously their cancer treatments, any types of scans or medicines or blood work that they need, doctor's appointments, all that is covered. But that also includes things like housing for when the families are here for their treatment. That includes subsidizing transportation to get to the hospital, whether that be by car or plane or whatever. So all of those things are also expenses that families have to incur when their child is getting treated. And for some of these treatments, they can be months or even years long. It depends on depends on the cancer. So this is a huge burden for families. And the big kind of overarching focus is that St. Jude only wants families to have to worry about curing their child. That's the only thing they really want you to focus on and worry on as a family. And so we try to remove as many of those barriers as we can. On top of all that, we have lots of there's a diverse range of services that St. Jude offers. So of course we have oncology, includes all the nursing staff and surgery and all of that, but we also have a fleet of child life specialists. We have chaplains who are in our spiritual care service to address any spiritual needs. We have a quality of life team that goes over different aspects related to palliative care and hospice care. We have music therapists. We have therapy dogs, like 2 full-time therapy dogs that walk around the hospital, and lots of different things that are hopefully there to help patients and families along their cancer journey. Again, I could go on and on, but it's a very, very special place. And once this pandemic dies down, settles down, and if anyone is in the Memphis area, we do offer tours at St. Jude. So if you'd ever come, not right now, but if you'd ever come like to come in the future to tour St. Jude and see the facility for yourself, I really encourage you to do that. It's an incredible place.
Sounds like it. It sounds like we need a lot more St. Jude's out there.
Yes.
So what's your role on the VHL CCC team at St. Jude?
Yeah, so as people may or may not know, we're a pretty new addition to the CCC team, and we're very, very excited to be part of the VHL Alliance. So my job as the point person is really to be that first point of contact for families or for healthcare providers who are interested in providing or interested in their families receiving care at our center. So as one of the genetic counseling team or genetic counselor on the team, I meet with patients and families. I will take a detailed family history. I will take, ask some questions about their medical history as well. And then I will talk about the different things related to evaluation. So I'll make sure that the family doesn't have any questions about VHL. Thankfully on the VHL Alliance website, there's a lot of excellent educational information, but we know that not all information that's available to families is as robust and accurate as is what's on the Alliance's website. So I make sure that there aren't any misconceptions or questions that have come up. I also just help the family address any type of like emotional needs or reactions or thoughts that they have to surveillance and that type of information. I also provide the families with written information about VHL, both stuff that we've written internally at St. Jude and things that are available on sites like the VHL Alliance. Also provide them with kind of a roadmap of our surveillance plan for their child to make sure that they understand exactly what the tests are that we're going to be doing as the child grows, and that they know why we're doing them, things like that. We like to see our VHL families once a year in clinic, just to touch base, make sure there aren't any questions that have arisen, and we can address any concerns that have popped up along the way.
That's great. What would you say are the most challenging and rewarding aspects of your job?
Yeah, that is also another big question that I could be here all day talking about. So, I mean, rewarding is so easy. That's an easy thing to answer. It's really the patients and the families. Pediatric oncology is unique in that you are oftentimes talking to parents about the health of their child as opposed to talking to the patient directly about their own health. Obviously, it depends on the age of the child, obviously, but what I'm trying to say is that you're talking to the family as a unit, usually. You're not just addressing a single person and their single healthcare needs. It's really about the needs of the family, which can be very layered and very complex and can definitely change over time. I think the things I find most rewarding is when you are meeting with a family and you're able to provide them with a piece of information that maybe they've never heard before, or it helps the family make a connection about something in a new way, and you see that light bulb go off in their mind. That is very rewarding, because that's ultimately what we want to do as genetic counselors, is to educate and support and provide that those pieces of information that are meaningful for families to make those connections. And as far as challenges go, I mean, I think there are things that anyone can imagine. Childhood cancer is very sad. You know, it's a very sad thing, and we have made great strides in the past decades on things as far as survival and quality of life, things like that. But I mean, there are still children that pass away, and it's very, very sad. And I know that's a huge driver in the hospital to try to keep making those research strides so we can continue to cure childhood cancer. But it's always challenging when you're walking through anything difficult with a patient and their family, but especially childhood cancer. It can be very hard, very hard as healthcare providers, and of course for the families.
Yeah, I could imagine.
Mm-hmm.
What's been your most memorable professional experience?
That's a very good question. Again, there's so many. I know I keep saying that, but it's true. I've worked with several families where something has been going on in their family for generations from a cancer perspective, and they can tell you, going back many generations, there are lots of people in our family who have had cancer or who have had health problems, and we've never been able to figure out what it is. And now, in the era of genetic testing being in general much more widely available, and we know about more genes now, we know about different ways to look at a family, I've been able to answer that question for families of why is all this cancer happening in my family, and we're able to give them an answer, which is very rewarding. One that comes to mind, it was not a family with VHL, it was a different genetic condition, but this mother was she was astounded. She goes, we've had doctors tell us literally for decades that there's something in your family, we just can't figure it out, we just don't know what it is, and here on this piece of paper, you're able to tell me what condition is in my family and why this has been going on. It's very rewarding to be able to do that, and to be able to name that thing for the families that was in the past just this giant mystery. So as far as rewarding experiences, I think anytime I'm able to give a family more information that is useful for their health or useful for their family's health, that's it. That's why I do this.
Like you said, that knowledge, just the knowledge alone is extremely empowering. So it's really important work. Mm-hmm. Now, how important is coordinated care when it comes to children who have VHL?
I'd say it's essential. Honestly, it's essential. VHL is one of those conditions where I think there's several things that are unique about it. First of all, there are so many different body parts that can be affected with VHL, right? So we have, the eyes, the central nervous system, the brain and the spine. We can have the pancreas, the kidney. I mean, there's so many different parts of the body that need to be screened and need to be watched closely with VHL. And so you need to be able to coordinate that well, because it requires different tests. It requires MRIs, ultrasounds, lab work, maybe some specialized like eye equipment. I mean, there's all these different tests that are needed. The other thing that's challenging, and I think it's not entirely unique to VHL, but it's definitely something that folks with VHL need to be thinking about, is that the age range that we can see these tumors. So you really need to start very, very young when screening these children with VHL, and that continues essentially for life. There are some other genetic conditions that predispose to cancer where we think the time you're going to get cancer is a pretty tight window age-wise, and so you really just need to watch for a certain age range. VHL is not like that. We need to be watching for your whole life. And so it's not just coordinating a few doctor's visits. It's coordinating doctor's visits and scans forever, basically for the lifetime of the patient. So in that way, I do think coordinated care is essential, because it's a lot for even the savviest patient to try to do all that on their own and coordinate all that on their own. I'd say it's probably close to impossible. So it's very, very important that people understand the care that people with VHL need, and on top of that, having some type of partnership with somebody who's going to assist in that coordination.
Yeah, you're so right. So how does the role of the genetic counselor change as a patient with VHL gets older?
Yes, so it definitely does change. So as I sort of alluded to earlier, when a child is quite small, obviously a 2 or 3-year-old is not going to be able to participate much in a genetics discussion. So really those discussions are with the parents. But as the child ages, maybe getting to ages 7, 8, 9, 10, that age, they're able to understand more. Again, children may not understand or be interested in understanding every aspect of their care or their disease, but they are able to understand maybe why they're coming to the doctor more than their peers, or that there's a family history of cancer in their family. And so that's why they need to be doing all these extra checkups, that type of thing. And so we do try to open that conversation more with kids of that age, just to ask, tell me what you understand about why you're here today. Did you have any questions about the things that your mom and dad and I were talking about? Things like that. And then as it gets into the teenage years, that becomes even more essential, because our goal is for teenagers eventually to become adults that are in charge of their own healthcare. And they can't be in charge of their own healthcare if they don't understand why this is important. So in the teenage years, we like to especially hit home about, going into more in depth about, here's why you're coming, here's VHL, what it stands for, what it is, what your mutation is, and make sure that is understood about what is a mutation and all of that. Also, of course, reproductive discussions have to come into play then. So understanding that there is a chance that this can be passed on to future generations. And do you have any questions or thoughts or concerns about that? And also addressing some of the emotional stuff. There's a wide range there of people of any age, but I think especially teenagers. Some teenagers, or they say at least, that they don't really care, it doesn't really bother them. Some are very, very anxious about it, and some have a lot of questions and feel very empowered by this information and all of that. Much like adults do. I mean, I feel like adults have the same range of emotions in that regard. And then obviously, as people enter young adulthood and into adulthood, the goal is that they will be fully informed about VHL, what it is, why they're coming, why it's important, and make sure that all of their questions have been answered along the way.
Thank you. It's a really important role, and makes a huge difference in the overall care and well-being of the patients and families. So thank you.
Mm-hmm.
Do you have any tips for parents dealing with the child's VHL diagnosis?
Yeah, there's a few things. So if you haven't already, I would definitely encourage people to go to the VHL Alliance website. There is a ton of good information on there. And again, obviously I see patients with lots of different syndromes, but VHL Alliance is one of the better patient advocacy resources, I must say. There are lots of other excellent resources out there too, but the VHL Alliance is just very robust. All the information from what I've seen is up to date and changes and is evolving as needed, which is excellent. Lots of good information there. I know that patients and families have often found a lot of sources of comfort and support in different social media groups, so Facebook groups or other groups like that are related specifically to the disease. Obviously, as with social media, there's good and bad things about it, but I've had many families tell me they found some great support from those folks. And then as far as, I got to give my plug for genetic counseling. If people are wanting to talk with a genetic counselor, either about testing or surveillance or some other aspect to the genetic piece of it, you can go to findageneticcounselor.com. And you you can search by zip code and by specialty, or you can just search by zip code, and it'll pull up the names and contact information for genetic counselors in your area. So that's a really good place to go. Your oncologist or other doctor may also have a personal connection with a specific genetic counselor in your area. So that's another place that people can go for support or for resources.
Now, we've gotten to know a lot about what you do in the hospital, but what other passions or hobbies do you have outside of the hospital?
Yeah, so coronavirus has squashed some of them, I'll say. So as you mentioned at the beginning, I live in Memphis, Tennessee. And for those who have not ever been to Memphis, it's an incredible place. I love living here. But they are definitely known for their food scene here. So we are a big barbecue place. So the International Barbecue Competition is held here every year. So people from all over the world come here to do their barbecue contest. So I like exploring new barbecue places, new restaurants in general. There's a lot of large parks in Memphis. So I'll go hiking or walking around with my family. That we can still do in the era of coronavirus, safely distant from other people. So yeah, walking around those open green spaces with my family. We like to travel as well. We have family kind of all over the Southeast and beyond. So again, in normal times, we travel to see family. And that's about it. I have 2 young kids, so they are mostly my focus these days, and they take a lot of energy and time out of me, but it's all fun. It's all fun times.
That's great. So if you could give young people with VHL one piece of advice, what would it be?
Mm-hmm. I would say, it's cliche, but I would say knowledge is power. Knowledge is power. So understandably, people have a lot of different thoughts and feelings about a diagnosis with VHL. It's a lot. It can be a lot to process. And I know I'm biased as a healthcare professional, but in general, I do believe that knowing something and being as informed and empowered about it as possible is better than not knowing or ignoring or pretending that something isn't going on when it is. So I would say, yeah, that knowledge is power. that you can, there's a lot that you can do with knowledge. And in general, not that everybody is the same, obviously, and everybody has, can go through some hard times. But what I've found is that more often than not, the families or the people that do embrace this information, that do educate themselves or try to educate themselves, that do ask those questions from their healthcare providers, that do participate in surveillance, participate in all aspects of their healthcare, they do okay. People, that you get through the other side, even though there's hard times. But in general, I think that people do better in the long run if they have this knowledge and take advantage of it and use it to help themselves and their families and ultimately their own health.
Yeah, I totally agree. So we have a couple questions from the live audience. This one is about St. Jude. Mm-hmm. Is there an age range that St. Jude treats, and is there what is the catchment area for patients who are able to be treated at St. Jude?
Yeah, that's a very good question, and I'm glad that the person asked that. So there's a couple ways to answer that question. So we are a pediatric hospital. So in general, we treat children and young adults. So by that, I mean birth, obviously, so babies to 18, early 20s. And the reason I'm kind of hedging is it depends. So to answer that other question about the catchment area, so if you are within the Memphis catchment area, which is a 180-mile radius around the city, and you are a child or young adult with cancer, you can come and get treated at St. Jude. Kind of that's it, because we're the place in the area that can be treated. If you live outside of that catchment area, then you need to have a cancer or a condition that has an open clinical trial at St. Jude. Now, there are dozens of clinical trials at St. Jude, and they're actually all listed on the St. Jude website at stjude.org. And so you have to be referred by an oncologist and accepted at St. Jude and go from there. Now, some of the trials, you can be a little bit older, like some of the brain tumor trials, you can be like up to 25 years old. Like it depends on the trial. That's why I'm kind of hedging that age. But yes, if you're outside of the catchment area, you do have to qualify for an open trial, and your local oncologist should be able to help facilitate that. And even if the patients and family or the patients aren't able to be treated at St. Jude, sometimes outside oncologists will consult with the St. Jude physicians who can give their input on care. So, it's not like an all or nothing thing. Now, from this is important thing I want to emphasize from the surveillance perspective. So if you are a family who has VHL and you are in our Memphis catchment area, which again is a 180-mile radius, you can come to St. Jude to get your surveillance with us, or your children can come to St. Jude to get their surveillance with us, even if they don't have cancer. So that is a really important thing I want to emphasize. If you are outside of the catchment area, unfortunately, at this time, we're not able to accept people for surveillance outside of that catchment area. But if you're within it, if you're 180 miles from Memphis and you have VHL and you have children with VHL, reach out to us and we'll chat about your situation, but we are able to do surveillance.
So you touched on this a little bit, but for patients, let's say, that are either outside of the catchment area or let's say out of the country, does the doctors at St. Jude do teleconsultations, or is there any telemedicine that they do there? Yeah,
another good question. I don't 100% know the answer to that question, that specific question, so I won't answer because I don't want to speak out of turn. But we do accept international patients. So if there is a patient in another country that has cancer, we are able to accept international folks for treatment. I know there are some restrictions there as far as numbers, and again, I don't know specifics of that, so I don't want to speak out of turn, but we are able to accept international patients. And I do know that if an oncologist or a doctor has questions about treatment, we are able to do consultation, as in like review a patient's scans and review their treatment plan, and the doctors can give input to their doctors about recommendations.
Wow, that's incredible. So we have one last question for you from the audience. What age do you think children should be told their genetic results?
That's such a good question. So here's what I think. First of all, it depends on the child, obviously. And I do tell parents, you know your child the best, right? So I do think in general, like, yeah, parents are in general the experts on their kids. So you know your kid. That being said, I can tell you that kids are incredibly perceptive. They usually know something's up, even if you don't tell them. And even if they don't 100% understand the details, they may know that something's different or something's changed. One gauge that I've found that parents have found helpful is, how have you discussed other difficult information with your child in the past, and how has that gone? So for example, maybe a family member has died, or maybe there was some type of other crisis within the family, like a lost job or something like that. How did you talk to your children about that type of information, and how did it go? Not saying that a VHL diagnosis is like a crisis or anything like that, but what I'm trying to say is that I find that type of inter and intra-family communication has some similar themes to it. So I think whenever a child is able to understand that they're going to the doctor for scans for some reason, that you can start that conversation. It doesn't have to be all at one time. So you wouldn't sit down with a 6-year-old and go through the details of like what an MRI does and, what genetics is and things like that, because they may not be able to understand it. But I think a 6-year-old could understand that, we're going to the doctor so that you can get a checkup to make sure that you're healthy. And people in our family need to do that more often than other families. I mean, that's something pretty simple that can start that conversation. And then as a child grows, they may ask you questions. They may direct the conversation, which is, helpful. The other thing I tell parents is, don't feel pressure to have all the answers. So it's very okay to say, you know what, I don't know the answer to that question. Let's research it together and figure out what the answer is. And this is also where a genetic counselor or another healthcare provider can be helpful too, is they may have some resources or some ideas about ways to explain things, or maybe some helpful websites or some helpful books that may be able to explain some of these things. They may even have connections with other families who have VHL, who are in your area, that are welcoming that contact. But as far as an exact age of when to tell kids, I don't know that there is an exact age because every kid is so different. But I think in general, kids can handle information of some kind younger than maybe parents expect sometimes.
Yeah, I think you're right. We don't give kids enough credit. And anyhow, Gina, I know I asked you earlier what makes St. Jude so special, but after getting to talk to you today, it's clear that what really makes St. Jude so special are the amazing and caring people there like you. So once again, I just really want to thank you for taking the time to join us today, as well as everything you do for your patients and the entire VHL community. Thank you.
Thank you so much. It's been great to speak with you guys today, and we're very, very excited to be a part of the VHL Alliance.
Thank you. And for everybody who's watching at home, you can learn more about the VHL Clinical Care Center at St. Jude Children's Research Hospital by going to vhl.org/St. Jude. That's vhl.org/STJUDE. We hope you will join us for future events, including an upcoming CCC Spotlight session with Dr. Kim Nichols, the sponsoring physician from St. Jude. Until next time, stay safe. Gina, thanks again.
Thank you.